If you haven't regained full range of motion in your shoulder after breast cancer surgery, wall walks can help. They're an effective exercise, but they're often done improperly. This video covers 3 common errors when doing this movement. Watch on to ensure you're getting the most out of this exercise. Hi, I'm Erica. I'm a breast cancer thriver and a chiropractor. There's 3 time periods where you can benefit from doing wall walks. The first is when you're 3 weeks out from breast cancer surgery, and this is usually a part of your regular rehab routine at that stage. The second time period is when you haven't regained full range of motion at some point after breast cancer surgery. This could be many months or even years later, and you're still having trouble putting your arm up overhead by your ear. The third time period is reintroducing this exercise after radiation, where you may have some setbacks in your shoulder motion. There's 2 variations of wall walks, out to the front and then to the side. Start facing the wall and place your fingers on the wall at waist level. Slowly walk your fingers up the wall until you feel a stretch but no pain. You can hold 10 seconds or 3 deep breaths at the top and repeat this about 5 times. As you improve, you can move your feet and your body closer to the wall. For wall walks to the side, you're going to repeat all the same steps, but you're just starting out in a different position, which would be perpendicular to the wall. Slowly walk your fingers up the wall until you feel a stretch but not pain. As you improve, just like the previous exercise, you can move your feet and body closer to the wall. Improvements with side wall walks are slower, so this is usually where most of the compensations happen. Coming up after I review the errors, I'm going to go through how hard to push your range of motion depending on what stage you're at. The first error is raising your shoulders up. This happens in both variations, but tends to be worse when you're raising your arm out to the side. When you raise your arm up and then you're hiking that shoulder, you're actually not increasing the range of motion anymore. You're just tightening up your trap muscle, which usually leads to neck pain. You can see that if I raise that shoulder up, look at my range of motion, and then I'm gonna loosen this muscle here. When I do that, you can see how my arm actually lowers down. So that's my true range of motion, and this is not. Try your best to keep your shoulder down throughout these movements. With rehab, we want to try to train our bodies the way we would move our bodies in everyday life. So if I'm doing an exercise and I'm hiking my shoulder up every time, that's going to translate into, let's say, putting something away on a shelf. You're probably going to be doing it like this. The second error is bending your arm when you're raising it up. This is another example of how our bodies compensate to try to get more range of motion than we actually have. Again, we want to try to train our actual ranges of motion in the shoulder rather than compensation type patterns. Do your best to try to keep your arms straight throughout these movements. The third error, and most common, occurs only with the side variation. It's moving the arm forward rather than keeping it at your side. You'll be able to raise your arm higher when it is in that position further out to the front, but again, this is another compensation that your body is doing, as that movement straight out to the side is one of the stubborn movements to try to gain back. An easy fix is to set yourself up in a corner to do this exercise. You would still stand perpendicular to a wall like before, but your back would be against the other wall. As you walk your fingers up the wall, you would use the wall behind you as a guide to keep your arm in line with your body rather than out in front. You may notice that you can't raise your arm as high by doing this, but again, that's okay, just like the previous examples. If you'd like more tips and rehab after breast cancer, hit that subscribe button down below. You can use painter's tape on the wall to mark your progress. It can be nice to see actual objective measures of improvement over time, especially if you're in the early stages of rehab after surgery or your shoulder motion has been reduced for some time. Place tape at the highest point when you start out doing this exercise, and then you can recheck week by week to see your improvement. How hard should you push through when you're doing these exercises, as they can be a bit uncomfortable? If you're between 3 and 6 weeks after breast cancer surgery, it's okay to feel some degree of stretching only in the shoulder or underarm area. If you're feeling some sort of tugging or pulling at your incision site, then you definitely want to back off. This could be your incision in your breast area, so whether you had a lumpectomy or a mastectomy, or that separate incision in the underarm area if you had a lumpectomy. Once you're past the 6-week mark after surgery, you can push things more, as there isn't any risk to pulling on those incision sites. If you're many months or years out from surgery and you're watching this, you can definitely push much harder and be more aggressive with your range of motion. If you're doing these exercises after radiation, you can push the limits even further. The symptoms of radiation fibrosis can be really stubborn, and it is helpful to be a bit more aggressive to see improvement. What does being more aggressive or pushing the limits look like? It means that as you're raising your arm up and you do get to that end range, you're going to lean your body weight into the wall further, and that will help to put those tissues on stretch more. Treatment can be helpful in addition to the rehab to regain some of this range of motion, but you're really the only one that can get you fully there. If you combine wall walks as an active motion with passive stretching, you'll see even more improvement. This stretching series, which covers tension in the chest, underarm, and shoulder, is up next. See you there.